Welcome to the 5th class of our ECG course. Today we will be exploring the mean QRS axis. The QRS complex is an important part of an ECG, and the mean QRS axis helps us understand the overall direction of this complex in the body. So, whether you're a medical professional or simply interested in learning more about ECGs, you won't want to miss today's discussion. Let's get started. The mean QRS axis represents the general direction towards which the QRS complex is predominantly pointed in the frontal plane. To draw this axis, we can use the hexaxial lead diagram that combines the axes of the 6 extremity leads. By convention, the positive pole of lead D1 is at 0 degrees, and we can use this scale to measure the QRS axis. To calculate the mean QRS axis, we need to answer the question: in what general direction is the QRS complex predominantly oriented? We can do this by looking at the ECG and finding the leads that show tall are waves of equal height. The mean QRS axis points midway between any two such leads. If a lead shows a biphasic complex, the mean QRS axis must be directed at right angles to that lead. Let's look at some examples to understand this better. Recall from our 3rd class that if a wave of depolarization is oriented at right angles to any lead axis, a biphasic complex, RS or QR, is recorded in that lead. Reasoning in a reverse manner: if you find a biphasic complex in any of the extremity leads, the mean QRS axis must be directed at 90 degrees to that lead. Now look at this ECG. Do you see any biphasic QRS complexes? Obviously, lead D1 is biphasic and shows an RS pattern. Therefore, the mean electrical axis must be directed at right angles to lead D1. Because lead D1 on the hexaxial lead scale is at 0 degrees, the mean electrical axis must be at right angles to 0 degrees, or at either minus 90 degrees or plus 90 degrees. If the axis were minus 90 degrees, the depolarization forces would be oriented away from the positive pole of lead AVF, and that lead would show a negative complex. However, lead AVF shows a positive complex, with tall R wave. Therefore, the axis must be plus 90 degrees. In this next example, by inspection the mean QRS axis is obviously horizontal, because leads D1 and AVL are positive, and leads D3 and AVF are predominantly negative. The precise electrical axis can be calculated by looking at lead D2, which shows a biphasic RS complex. Therefore, the axis must be at right angles to lead D2. Because lead D2 is at plus 60 degrees on the hexaxial scale, the axis must be either minus 30 degrees or plus 150 degrees. If it were plus 150 degrees, leads D2, D3, and AVF would be positive. Clearly, the axis is minus 30 degrees. In electrocardiography, the mean QRS axis is a crucial measurement that should be taken for every patient. A normal QRS axis is typically between minus 30 degrees to plus 100 degrees. If the axis is more negative than minus 30 degrees, it's called left axis deviation. If it's more positive than plus 100 degrees, it's called right axis deviation. The mean QRS axis is determined by the position of the heart and the direction in which the stimulus spreads through the ventricles. Various factors, such as respiration and fascicular blocks, can affect the QRS axis. The terms electrically vertical and horizontal heart positions are qualitative, and they do not necessarily indicate the presence of actual axis deviation. Right axis deviation is an extreme form of a vertical mean QRS axis, while left axis deviation is an extreme form of a horizontal mean QRS axis. For beginning students, precise calculation of the QRS axis is not as important as answering the following key questions. Is the QRS axis normal, or is LAD or RAD present? The answer can be obtained simply by inspecting the QRS complex from leads D1 and D2. If the QRS complexes in both leads are positive, the axis must be normal. If the QRS complexes is predominantly positive in lead D1 and negative in lead D2, left axis deviation is present. If the QRS complex is predominantly negative in lead D1 and positive in lead D2, right axis deviation, or at least borderline right axis deviation, is present. Very rarely, The QRS will be predominantly negative in both leads D1 and D2. In such unusual cases, extreme right or left axis deviation will be present. Axis deviation is a common finding on electrocardiograms or ECGs, which are used to diagnose various cardiac conditions. Let's take a closer look at the clinical significance of axis deviation. Right axis deviation is seen when the mean QRS axis is plus 100 degrees or more. It may be seen in normal hearts, but it can also indicate right ventricular hypertrophy, which is a serious condition. Right ventricular hypertrophy occurs when the right ventricle becomes enlarged and thickened, which can be due to a number of factors. Right axis deviation can also be caused by myocardial infarction of the lateral wall of the left ventricle, left posterior fascicular block, or chronic lung disease such as emphysema or chronic bronchitis. In some cases, acute pulmonary embolism can cause a sudden shift in the mean QRS axis to the right, but it may not necessarily cause actual right axis deviation. Left axis deviation, on the other hand, is seen when the mean QRS axis is minus 30 degrees or more. It can be seen in patients with left ventricular hypertrophy, left anterior fascicular block, or left bundle branch block. Left ventricular hypertrophy occurs when the left ventricle becomes enlarged and thickened, which can be due to a number of factors. Left axis deviation may also occur in the absence of apparent cardiac disease, and it's not necessarily a sign of significant underlying heart disease. Nevertheless, recognition of right or left axis deviation often provides supportive evidence for other disorders. It's important to note that the limits axis deviation used here are necessarily arbitrary, and different authors may use different criteria. This reflects the fact that no absolute parameters have been established in clinical electrocardiography, and only general criteria can be applied. Finally, in rare cases where all 6 extremity leads show biphasic complexes, which makes it impossible to calculate the mean frontal plane QRS axis, the term indeterminate axis is used. An indeterminate QRS axis may occur as a normal variant, or may be seen in a variety of pathologic settings. Thank you for taking the time to learn with us today. We hope that you found this 100% online and free ECG course valuable, and that it helps you advance your knowledge and skills in this important field. If you did find this course valuable, we kindly ask for your support. Please share this video with your colleagues, subscribe to our channel, and give us a positive evaluation. And if you're able to, please consider donating any amount you can using the link in the description below. Your support will help us continue to provide free, high-quality education to everyone who wants to learn. Thank you again for joining us, and we hope to see you in our next lesson. Before we wrap up, we'd like to let you know that our next class will cover atrial and ventricular enlargement. This is an essential foundation for interpreting ECGs, and we're excited to delve deeper into this topic with you. So be sure to subscribe to our channel and hit the notification bell so that you don't miss our next lesson. Once again, thank you for joining us today, and we hope to see you soon in our next 100% online and free ECG course.